On the morning of June 14th, Elsie Wilson went into Harrington Hospital, into the emergency room department, where she's worked as a nurse for 35 years. A 25-year-old patient came in, complaining of some arm pain, and as she brought him back to the exam room, she had no idea that he was angry about not receiving his opiate pain meds 2 weeks earlier. When they went into the room, Connor Reagan locked the door behind him. He waited for Elsie to turn her back, and then he attacked her and stabbed her 11 times in the head, neck, and arms. Elsie yelled for help, but her co-workers and security could not reach her because the door was locked. Once they broke it down, Connor O'Regan attacked security and ran off, while her co-workers tried to save her life. This is not an isolated incident. I've been working as a nurse for 2 years. I've been hit, kicked, spit on, and verbally and sexually aggression by patients. Workplace violence in the healthcare industry is a serious problem. It requires stronger action by healthcare facilities and Congress to enact laws to make this change and protect workers. First, we need to look at the seriousness of the problem, identify solutions that can be instituted to change this problem, and what laws can be enacted to make sure that this takes place. Workplace violence in healthcare is defined as any verbal, written, or physical aggression toward any type of healthcare worker in a healthcare setting. Violence against healthcare workers is a much larger problem than the public may realize. Ann Scott Bolvin, who is a member of the Joint Commission, in her article, Taking a Stand Against Workplace Violence, noted that the healthcare field experiences higher rates of workplace violence than any other industry. Serious violence is 4 times more likely to take place against a healthcare worker than in any other private industry. The article further noted that violence against the healthcare workers is more common than even violence against police officers. The rates are actually even higher than reported. That's due to the culture in healthcare, where reporting such incidences are discouraged and considered just part of the job. This is written about in an article called Predictors of Trivialization of Workplace Violence Among Healthcare and Among Law Enforcement Officers. Steve Geoffrin and his colleagues noted several reasons for this low rate of reporting. Healthcare workers attribute aggression to the medical conditions of the patients. They do anything they can to not break the bond between patient and worker. They do not want to get the negative feedback from their peers or judgment from management, and that it's commonly accepted as just part of the job and that they just have to cope with it. Environment not only affects the workers, but it also affects patients and visitors that are at the hospital. Patients should not be fearful of what's going on around them, such as a healthcare worker being attacked in just the room next door. Injury and burnout causes workers to take extra time off and causes problems with chronic understaffing. Lisa Pompai, who is a professor, wrote an article that's discussed healthcare violence as a public health issue. This article notes that when public violence happens, the community is so much more aware of what's going on. But when it's in a workplace, they really just don't even note that healthcare workers are in danger every day. So what's the solution? Model legislation has been proposed by the American Nurses Association. Their model is called Violence Prevention in Healthcare's Act. It gives us an idea of what needs to happen to make sure changes occur. It proposes require healthcare entities to establish programs that protect workers, that there be government oversight of those programs where they're held accountable for their effectiveness. Violence prevention and de-escalation techniques need to be taught to workers and renewed yearly. There should be increased staffing and security measures. Things such as metal detector installation, searches of bags, and removal of devices to help protect workers. There should be mandatory reporting of incidences and records kept for each facility. And also, and most importantly, there should be no penalties for victims reporting the incidences. Elsie's Law is now in Congress. It covers these points, along with asking for stiffer penalties legally for those who attack healthcare workers. This law would enable all these standards to be instituted nationwide. Imagine how this could have changed things for Elsie Wilson. Mr. Reagan would have never made it into the ER had he been walking through a metal detector, if he had been searched by security, and had there not been a lock on the door, everything could have changed for that incident. Patients and visitors should not fear going to the emergency room. They should not hear verbal and physical aggression toward the workers. Increased safety measures have been instituted in California. They've shown to be effective, increase worker safety and satisfaction ratings. So now that we know and understand the dangerous conditions that face healthcare workers every day, and that going to work as an assistant, a nurse, or a physician really affects personal safety, we understand what changes need to occur. Increased security, training for workers, penalties for attacks, and holding facilities responsible for healthcare workers' safety. So how do we make this change? Right now, Elsie's Law is in Congress. It's entitled the Workplace Violence Prevention Bill. Write or call your congressman. Ask them to bring it to the floor for a vote and enact it into law. Show them that we are no longer going to tolerate these conditions.